In this video, we will see about the classification of different shapes of pelvis and their clinical significance, and the abnormalities of the pelvis. So, in this, first let us see about the classification of pelvic shapes. It is classified under Caldwell and Molloy's classification. And this is based on the morphological features of the pelvis. So, this is a morphological classification of the pelvis, which was done by two scientists, Caldwell and Molloy, based on their X-ray studies. So, this is Caldwell and Molloy classification. According to this, the different pelvic shapes include Anthropoid pelvis, Gynecoid pelvis, Anthropoid pelvis, and Platypuloid pelvis. These are the four major types of pelvises, and we will see the characteristics of each one of them in detail. So, these are the four different shapes of pelvis: the anthroid, gynecoid, anthropoid, and platypuloid. Let us compare them and study so that it will be easier. First point is about the pelvic inlet. The inlet in case of anthroid is heart shaped. As you can see from this picture, it is heart shaped. And in gynecoid pelvis, the inlet is slightly oval or round. Whereas in anthropoid pelvis, in the inlet, the anteroposterior diameter is greater than the transverse diameter. So, it is vertically oval. Whereas in case of platypuloid pelvis, it has a transverse oval inlet. So, the transverse diameter of the inlet is more than the anteroposterior diameter. So, as you can see from this picture, the anthroid pelvis has heart shaped inlet, gynecoid pelvis has slightly oval or round inlet, anthropoid pelvis has transversely shorter and anteroposteriorly longer, that is vertically oval inlet, whereas the platypuloid pelvis has transversely oval inlet. So, the next is the mid pelvis. The mid pelvis, in case of anthroid pelvis, the side walls are usually convergent and the ischial spines are more prominent. Whereas in gynecoid pelvis, the side walls are straight and the spines are not prominent. So, the gynecoid pelvis is more favorable for the delivery of fetus. Next is the anthropoid pelvis. Here the side walls are usually convergent and the ischial spines are likely to be prominent, which is almost same as that of the anthroid pelvis. Next, the platypuloid pelvis. Even here the side walls are straight as in case of gynecoid pelvis, but the ischial spines are very much distant to each other. So, there will be very wide interspinous diameter. This is about the mid pelvis. Now coming to the outlet. The outlet in case of android pelvis, the subpubic angle is narrowed, whereas in case of gynecoid pelvis, the pubic arch is wide and in anthropoid pelvis, the subpubic arch is narrowed. And in case of platypuloid pelvis, there is very wide subpubic arch. So, the wide subpubic arch is a favorable feature for the delivery of the baby. The same way, straight side walls and the spines which are not prominent also favor easy childbirth. Next, coming to the sacrum. In case of android pelvis, the sacrum is straight with no curvature or little curvature, and the sacrosciatic notch is narrow and it is highly arched. This is in case of android pelvis. Whereas in gynecoid pelvis, the sacrosciatic notch is well rounded and it is never narrow. And this, so it is either rounded but it is never narrow. Then coming to anthropoid pelvis, here the sacrosciatic notch is large. And in case of platypuloid pelvis, there is narrow sacrosciatic notch. So, these are the important points about the four main classes of pelvis based on their morphology: the android, gynecoid, anthropoid and platypuloid. Overall, the gynecoid pelvis is more favorable for the birth of a child. So, the others are android, anthropoid and platypuloid, and these are the features of each one of them. Next, there are intermediate or mixed type of pelvises. These are the more common pelvises seen. So, most of the pelvises are of the intermediate or the mixed type. In such cases, the name and type of the pelvis is based on the posterior segment. For example, if there is a pelvis in which the anterior segment is android, has android features, and the posterior segment has gynecoid features, then the pelvis is named as gynecoid pelvis because it is named based on the posterior segment with android tendency, which forms the anterior segment. So, this is called as gynecoid pelvis with android tendency. Now, let us see the clinical significance of the different shapes of pelvis. First is small gynecoid pelvis. So, here in small gynecoid pelvis, all the pelvic diameters are decreased proportionately, but it retains its normal shape, that is the gynecoid shape. So, because of which there is delayed labor at all stages of labor, and to overcome this there should be powerful uterine contractions present to overcome these small gynecoid pelvis and to push the presenting part downwards. Next will be the android pelvis. In the android pelvis, the occipito-posterior position is more common. This is because there is less space in the posterior segment, so the occipito-posterior position is more common. And due to the funnel shape of the pelvis with converging side walls, there is failure of rotation during the mechanism of labor. So, this leads to transverse arrest. Deep transverse arrest at the level of ischial spines is more common in case of android pelvis. Next, in anthropoid pelvis, so in the anthropoid pelvis, persistent occipito-posterior position is common because of inability to undergo rotation. And in the platypuloid pelvis, there is difficulty in engagement of the fetal head. Because of the transversely oval pelvic inlet. So, these are the clinical significance of each of the types. Next, coming to the abnormalities of the pelvis. First will be rakitic flat pelvis. This is seen as a consequence of childhood rickets which was not treated, but this is uncommon these days because vitamin D is routinely given during childhood. Next is the Naegele's pelvis. In Naegele's pelvis, this occurs because of the arrested development of one ala of sacrum. There is arrested development of one ala of sacrum. Next will be the Robert's pelvis. Here there will be arrested development of both the ala of sacrum. Next is kyphoscoliosis. So, this deformity is usually secondary to tuberculosis or rickets. There is kyphoscoliosis forward and lateral bending. So these are the different abnormalities of pelvis. Rakitic flat pelvis as a consequence of untreated childhood rickets. Naegele's pelvis, in which there is arrested development of one of the ala of sacrum. If both the ala of sacrum are arrested during development, then it causes Robert's pelvis. And lastly, kyphoscoliosis, which is usually seen secondary to tuberculosis or rickets. So this is all about the pelvis. Thank you.